Welcome back to Symptoms to Stories, the podcast where we put the public back in public health. I'm your host, Arin Tripathy, and today we're diving into an issue that affects many people in our community, but is often difficult to talk about: mental health. In episode 4 of Symptoms to Stories, we're joined by clinical psychologist Dr. Manju Kaul to discuss the current state of mental health care here in Tulsa, the challenges people face when seeking support, and how our community can move towards better access and understanding. Enjoy! Hi, can you please introduce yourself and what relation you have to mental health?
My name is Manju Kaul, Dr. Manju Kaul. I'm a clinical psychologist in private practice in Tulsa, Oklahoma.
Okay, Dr. Cole, can you first explain, what are the most common mental health challenges you see among the patients in Tulsa, and why do you think that they're so prevalent in this area?
So I really do primarily psychotherapy. So the most common mental health challenges that I see in my practice are really issues of depression and anxiety. I do not know that the frequency of those is different in Tulsa than in other parts of the country. I do believe mental health disorders tend to be fairly uniform in all parts of the United States. So what I see is not that different from what you might expect to see somewhere else.
Right. How do you believe that maybe some of these socioeconomic factors such as housing instability or income inequality could kind of impact the mental health outcomes for Tulsans or people living in the local Oklahoma area?
So I think the biggest way in which socioeconomic factors impact mental health outcomes is by lack of basic access to resources. So somebody who is not able to have health insurance cannot utilize a lot of services, and they do not have access to mental health resources. Beyond that, somebody who's maintaining just a minimum wage job or is doing 2 minimum wage jobs to meet basic needs really has no time to devote to a therapy session or to be able to access some of those services. So based on Maslow's hierarchy, if you need to get food on the table, you pay attention to that first before you pay attention to other things. So I think there's a large percentage of the population that is not affluent and cannot afford insurance, and therefore they do not have access to a lot of mental health resources. I think the other challenge that we face, especially in parts of Oklahoma, not only in Tulsa, is just not having enough providers. So if you go to some of the more rural areas, they have to drive long distances to get to a mental health provider. So I think that immediately limits access as well.
Sure. You kind of expanded on this in the last question, but first, what are some of the barriers that prevent people in Tulsa from accessing mental health care in the first place? I mean, you've already kind of explained that, but feel free to expand on that. But also, how do you think that some of these barriers can be reduced so that more people can access health care, specifically mental health care in the first place?
We've already talked about issues like transportation, meeting basic needs, lack of providers. All of those get in the way. There's also lack of knowledge, which I think people are often not even aware of what kind of resources they need to access. They don't believe that they have a mental health issue, or if they believe it, they believe that they can change it themselves. Pull yourself up by your bootstraps kind of mentality.
Yeah.
So I think there's definitely a lack of knowledge and insight, which also plays a role. I believe the biggest factor that would help overcome some of these barriers would be ensuring that mental health services are reimbursed well or competitively when it comes to Medicaid. So a lot of people who cannot afford private insurance are eligible for Medicaid. Right. Unfortunately, people who are Medicaid get very limited services, and these services are not reimbursed well for a lot of physicians, psychologists, mental health providers. So a lot of places do not accept Medicaid. But I think expanding that scope of service would really be a tremendous help in overcoming some of these barriers.
Sure, funding's always one of the biggest issues. Moving on from kind of what are the barriers, let's look at something more recent. Specifically, how do you think that the demand for mental health services in Tulsa has changed in recent years, and then how it kind of was affected by the recent COVID-19 pandemic?
So we are increasingly seeing a shortage of qualified providers. I believe the last statistic I had read was that for every 3 providers required in Oklahoma, we only have 1 provider providing services.
Right.
So that is a tremendous shortage. More than that, with the COVID-19 pandemic, what we saw was an increase of social isolation. And I believe the negative impact of that was really experienced by youth, young adults, people who were sort of maturing into developing socially and emotionally.
Yeah, 100%.
And so they experienced, I think, a lot of adverse effects anecdotally, and I have not looked up research in this, but I believe I have seen an increase in anxiety disorders. So people feeling anxious in social situations with any new challenge just because everyone was leading such isolated lives, hypervigilance for medical issues. So that, I think, is the negative effect. The one positive thing which I think we have seen is an expansion of online services, which is something that we had never even dreamt would happen pre-COVID. We always thought that ethically, can I really do a Zoom session with somebody? Can I do phone therapy? Can I do telehealth? Most providers were anti all of that because we believed in that sort of one-on-one interaction. But when we moved to Zoom platforms and online platforms, we realized that provided access to people who could previously not access services as easily. So I would say that on that end, it has been somewhat beneficial in developing platforms of delivery of services that are more innovative.
I 100% agree. Dr. Kaul, you specifically talked about social isolation. Specifically, I'm assuming adolescents were also affected by this. So what role do you think that schools and community programs in Tulsa could play in identifying and supporting individuals with mental health concerns?
That's a very good question. I really was looking at levels of mental health care when you asked that question. Schools and community resources tend to be far more psychoeducational in terms of the services they provide and the programs they provide. So schools have programs that are educational with regard to substance use or suicide prevention. So they provide that initial base of knowledge to hopefully everyone in that community. We hope that by providing those psychoeducational interventions or group programs, that teachers or psychologists in the school systems or social workers can identify people who are in need of greater services. The tricky part is really transitioning those people into a higher level of care, connecting them with mental health resources where they can get individual psychotherapy or join a more structured group that provides services that best match their needs. So to me, schools and community programs are the first level of care, and they work for people who are on the lower end of mental health needs and in providing education. But after that, we really have to tier up to really help people with more severe mental health issues.
Right. Dr. Kaul, you specifically talked about kind of particular populations specifically being needed to be connected with mental health resources. Do you believe that there are any particular populations in Tulsa, such as maybe adolescents, veterans, or maybe other marginalized communities that face unique mental health challenges? And then could you expand on some of those challenges?
So that's an interesting question, right? I have not come across any group that does not face certain unique challenges, right? So
Yeah.
with every developmental age, we face certain challenges through our own growth curve. And then depending on what community you belong to, we face social challenges because of that, whether it's socioeconomic status, whether it's ethnicity, race, the profession we pursue, and so on. So I believe that depending on which subgroup you belong to, you do face unique mental health challenges, but I think they manifest themselves in terms of diagnostic categories in a very similar manner. So, for example, an adolescent who feels like they don't fit in will be facing anxiety disorders or depression. A veteran who is dealing with post-traumatic stress disorder is obviously dealing with an anxiety-related issue, just in a slightly different manifestation. Or anybody who goes through a traumatic event will experience that. So an adolescent who's perhaps been through abuse of some kind may also manifest with post-traumatic stress disorder. I think, when there's racial bias and inequality in life, people face discrimination. Once again, they experience anxiety, depression, other mental health issues. So I think the challenges that each community faces or each subgroup faces are unique to that subgroup. But typically the manifestation of mental health symptoms tends to be very similar in terms of the disruption it causes in somebody's life.
Sure. There's probably a lot of overlap specifically when it comes to mental health challenges of different populations. But moving on from the populations themselves, how do you believe that current mental health resources and crisis response systems in Tulsa, how effective do you think they are, and specifically what improvements do you think are needed to kind of further the positive impact that they can have?
So having lived in Tulsa and been connected with some of the mental health resources here, I believe that we really have tried to step outside the box. We have tried to expand services in innovative ways to provide programming that really helps people in crisis response situations, as well as with providing access to mental health resources in different ways. I'm not quite sure about the current status of the program, but Family and Children's Services had started an innovative program where they had a counselor, a crisis intervention counselor available to go with the police and accompany them on emergency visits where they felt a mental health issue may be involved. So rather than just the police and law enforcement showing up, they would have a mental health provider accompany them so that they could actually channel somebody or provide the correct resources for somebody who's facing a mental health challenge. So somebody who's experienced being suicidal but was in the middle of traffic or on a bridge.
Yeah.
A law enforcement person would typically have to take them and incarcerate them. But on the other hand, if you have a mental health provider who talks to them and says, hey, let's take them to the closest emergency room. Let's figure out where we can place them. So you're not incarcerating somebody with mental health issues, but actually providing them mental health services right away.
Definitely.
A lot of these services are not funded because they're not reimbursable on an insurance, right?
Correct.
So the problem becomes, where does the community generate the dollars for those kinds of resources? And very often that's charitable giving. So these services really should be expanded, that all law enforcement agencies should have a mental health provider who can accompany them on a child abuse call or on something that prospectively could be a mental health issue. So I think that's really where we need to see the expansion, but it all comes down to dollars and cents.
Of course, Dr. Kaul. Finally, what strategies do you think that psychologists, recommend to improve mental health awareness and reduce the stigma that's associated with mental health in the local Tulsa community?
I think mental health awareness starts really at a grassroots level. So, from the time a pediatrician sees you or sees a parent, vaccinations are talked about, immunizations are talked about, or is your child in a car seat, and are they belted in at all times, are things that are addressed by a pediatrician. I don't know that the pediatricians necessarily always ask about mental health issues or what parenting challenges parents are facing and how they're dealing. So I think if we again look at the developmental curve through life, starting from early childhood, if we start bringing mental health issues to the awareness of parents and highlighting that right away, and then as they transition into school systems, really enhancing those kinds of interventions right in the beginning. So when we do parent-teacher meetings, are we assessing for any mental health needs that the child might have, other than the child who's highly disruptive, right?
Yeah.
Teachers will always point out that your child's being oppositional or difficult, but what they might miss out on is the child who's anxious or depressed, or a parent who's struggling with parenting challenges. So increasing mental health awareness in school systems, right from kindergarten, nursery, child care days, through, I think we're seeing more interventions like that through adolescence and in high schools. To me, targeting faith groups, churches, and other faith groups to encourage the belief that mental health issues are not to be stigmatized, that they should be taken seriously, and that this is not a failing by a person, but just a natural process. People consider diabetes and hypertension and all of that very treatable, and somehow when it comes to mental health issues, they're stigmatized.
Exactly.
And so bringing them into the range of normalcy is very important. I have seen now doctors' offices routinely on wellness checks will give a brief depression and anxiety questionnaire, which was unheard of several years ago. So just sort of being able to draw attention to that in the same way as we run wellness programs at the local Y and park systems, can we do mental health wellness awareness? So I think those kind of interventions would be really important in making sure that mental health issues aren't stigmatized and that they become more and more accessible for people.
Right. Proactive steps definitely help a lot in effectively mitigating these problems later in life. So thank you so much for your time, Dr. Kaul. I really appreciate it. Thank you for joining on the call and spending your time on the podcast.
You're so welcome, and it is always nice to see a young adult being involved in causes like this. So thank you so much, Arin, for taking the time to do this.
Thank you so much. That's all for episode 4 of Symptoms to Stories. A big thank you to Dr. Manju Kaul for sharing her insight on the state of mental health care in Tulsa and helping us better understand the challenges and opportunities facing our community. If you enjoyed today's conversation, be sure to follow Symptoms to Stories on Spotify, YouTube, and Instagram for more discussions where we put the public back in public health. Thank you so much for listening, and we'll see you next time.